Hi everyone, my name is Rachel Dixon. I'm a massage therapist and postural alignment therapist on Nantucket Island. I have been working in the massage field for over 20 years, and I have added on a lot of the postural work because when I first started massaging, massage fixed most of the issues that people came in to address. Massage was really great for relaxing the body, which is still a big issue in today's world, for releasing tight tissue, which is still a problem, but it is no longer typically getting to the root issue of people's issues of why they are in pain. So mostly people come to me typically because they're in pain in some areas, or they just want to relax. I do give a really great massage, but most people do come to me because they are in pain for some reason. 20 some odd years ago, people lived very different lives movement wise. We had 20 years ago, people had started having a lot of repetitive movements. So that had changed from maybe the 20 or 30 years before that. People had a lot more variety of movement 20 or 30 years before that. But so when I started, people had a lot of repetitive movements. They were very tight in particular area, and massage was very helpful. Then massage became a little less helpful. They felt really great after the massage. It addressed their muscle tightness. It helped their stress relief. In fact, people weren't as stressed 20 years ago as they are now. They're more stressed now. But people started having repetitive movements in different ways, particularly because of devices. We started using computers, and we started using computers regularly. We got cell phones. We didn't have cell phones 20 some odd years ago, and suddenly we had Kindles, and we have, and not only did we had started having computers 20 years ago, but we didn't use them regularly. And then we started using laptops, which really even were different than a typical computer use. So whether it was less movement, more sitting, more travel, and less overall movement and more devices, people's issues changed. And most of people's issues were initially coming from not moving correctly or not moving enough while in a stacked position. And so while most people still like to pay me for my time when I massage them, and it's very helpful, there are certainly clues I get about people's bodies when I'm massaging them that I don't necessarily get if I don't actually touch you, because I do have 20 plus years of touching people and being able to work on their bodies and feel things in them. A lot of what has been very helpful is not necessarily what I do when they're in the session, but the changes that I make for them when they're outside the session. I had someone who came in for, it was about 2 or 3 massages over an almost 2-year period of time. Okay, so not a lot. I saw her at not more than every 6 months. That's not very frequent when it comes to massage. And she made the comment to me, ever since I started coming to you for massage, my neck pain has gone away. Now, I gotta tell you, it was not the massage that I had done every 6 months that made a difference. It was that I retaught her how to hold her camera bag. I retaught her what to do at the end of the day when she had been hunched over her computer, putting in photos and doing things, to reverse the sort of negative postural deviations that she'd had all day, and what to do if she had that, those discomforts during the day. So it was interesting that she commented, ever since I came to you for massage, it wasn't really the massage. The massage helps to a certain extent. And if someone comes into me with a lot of pain, typically the massage and changing the tissue makes the biggest difference initially. And then it's about how you move the rest of the time. So I had helped this client learn how to move differently throughout her day and to correct herself at the end of the day. And that is what made the biggest difference. So I'm really happy to be able to teach these classes at the library, because so many people have so many people have accepted things as normal that don't have to be normal. They are very, very, very common. Yes, they are very common, but they don't have to be how it is for everyone. And I really feel like my purpose in life is to get this information out there. So that is what I'm doing. But to start, this information is for educational purposes only. Most of the exercises or exercises that I will teach you are safe for most people, but nothing should hurt. If anything hurts, if anything is aggravating to you, please stop, please see a doctor. You know what? I think I my phone number is on it. I think on this one, I was really late and tired last night, so I don't think I put a lot of my information, but typically my email is one of the easiest ways to get in touch with me, and that's either racheldixon@comcast.net or rachel@theartofbeingwell.com. And I always love talking with people and seeing what issues that you have that we can address. But lately, I have been getting a lot of clients with low back pain that is due to two particular issues. One is stenosis, and another one is spondylothesis. And so I thought that today's class, I would address both of those. They are very different, but because I've seen so many of them and I only have a few more classes to teach before my summer schedule, I thought I would address both because both of these are very painful situations typically, and they don't respond very quickly. They're both ones that respond very slowly. And so I thought I would hit both with one thing. Okay. So stenosis is an element where the canal in your back, where the spinal cord comes through, becomes more narrow. Okay, so it becomes more narrow, mostly because it builds up or creates like little bone spurs in there. Okay, so the space where the canal comes through you have less space in there than they typically have, and this typically causes a compression on the nerve, and then you get things like sciatica and other nerve impingement pain. And then the other one is spondylothesis. And spondylothesis is an element where the spine is a little bit more unstable. So instead of the spine being properly sort of like stacked on top of each other, you have one which has slid typically more forward. It could slide back, but honestly, I almost always see that it has slid forward of each other. Therefore, it is also compressing the nerve, but in a slightly different way. The postures that we typically see with these people are different as well. Typically, the postures that we see, so I might look at someone and go, oh, I wonder if they have if they have a stenosis. Spondylothesis, I don't necessarily look at someone and go, oh, I wonder if they have that, but for a stenosis, okay, it can happen in typically the low back is where I see it. It can happen in the neck. I honestly don't know that I would. What I'm teaching you today is if you have a stenosis in your low back as opposed to your neck, okay? But typically the posture that you would see is what PTX would call number 4, okay? You're gonna have a very flat back, okay? You're going to have a rounded upper back typically, okay? Because this back is so flat, but you have the rounded upper back, you're typically going to be leaning forward like this. To keep yourself from balancing to not go forward, you're typically going to either bend your knees a little bit or you're going to bend your elbows. It's like kind of create your weight to come back a little bit. Typically your shoulders themselves will be a little bit stuck forward like this, but you might bring your elbows back or bend your knees to be able to keep from falling forward. Now, if you have a spondylothesis, particularly if it's an anterior one where that vertebrae is slid forward, you typically have a really arched back. So instead of a really flat back, you have a really arched back and a really anterior hips. And then the rest of you is typically also probably a rounded upper back and a rounded neck that comes up like this typically, okay? Now, you can have, particularly if your spondylolisthesis was due to a trauma, you might have a handful of different postures as well. But it's very different. So when I look at someone's back when they get on the massage table, I can also see what looks like arthritis. Okay, of course, I cannot diagnose, but I look at someone's back and the muscles don't look as plump and healthy as they should. And you almost see a little, it's subtle, but I can look at someone's back and I go, I bet they have arthritis in there. Okay, and arthritis is really common. Because as we get older, things tend to degenerate, everything kind of dries out a little bit more. If you think about babies are very moist and plump, and even when they break their bones, they get a green strip fracture because there's so much fluid in their bones, things don't, they're not brittle. The older that you get, everything dries out a little bit more. Even our skin dries out, our bones dry out a little bit more, and things become more brittle. It becomes a little bit easier to break. But you can tend to look at the backs and understand. Now, here's the thing. Most people, if they correct the way that their body is stacked and they start to move more properly, people will improve typically the pain that they have. People could have surgeries with either a stenosis or a spondylolisthesis. And, if that is the case with you, it's not that someone didn't try hard enough or, to stack their body posture properly, but anyone that makes a decision like that, there's definitely compression of the spine with either of these things. And sometimes surgery is an option, but I'm getting sort of off of things. All right, let me get back onto stenosis. So stenosis, first of all, any questions before I continue? Okay, so stenosis is, like I said, a type of arthritis that has a buildup that narrows the inlet where our spine comes through. And it narrows it by creating these little like bone spurs, which narrow that area. So bone spurs typically happen in the body for two reasons. They happen like in the foot because you have plantar tissue that is too tight. It's constantly pulling on the periosteum of the bone, which creates tension. And that tension allows a gap, and that gap fills in with bone. So similar to if you broke your bone and your body fills that space with extra bone material to create to correct the fracture. When you have too much tension in that tissue that's attached to the bone, you will also create a space. It will fill in with the bone. It is uncomfortable, okay? Typically, bone spurs are uncomfortable, but you can address it, okay? Bone spurs in the back are caused because there's too much friction and movement in the back. So in some of our previous classes, we have talked about joints that are meant to be stable and joints that are meant to be mobile. The low back is one of the areas that's meant to be stable. The hips are meant to be mobile. The upper thoracic area is meant to be mobile. So when sometimes the hips aren't as mobile as they should, or the thoracic area gets stuck like forward instead of, more appropriately also going into extension, we will tend to have to move an area that's meant to be stable. So we'll tend to overuse our back. And so overusing our back for a really long period of time is going to create that friction that then creates the bone spurs. And most people will have gone a really long time with building this up. You will even have the stenosis for a really long time, and then suddenly it causes a lot of pain and you think, oh, I just had this issue. No, you would have had this issue for a really long time and suddenly got pain with it. So And then with the pain, you get x-rays and MRIs and you see, oh, I have stenosis. The issue took a long time to create. It does typically take a long time to correct, and you do need to move a little bit slowly with this one. But the more that you correct the body alignment and look to create a stable back, the faster that's going to improve for you. It's also good to know that even though it took a long time to get there and a short time to create pain, you might be able to get a short time to get out of pain as well, but then you're going to want to work on this for a really long time. So if you have a stenosis, honestly, everyone should be doing this stuff all the time. You know, everyone should be constantly looking to get their bodies in the best alignment as possible. Okay, so, so aligning the body goes a long way at correcting the posture. And with the posture you want to correct, right? So you have this flat back that has the arthritis. You want to be able to create better stability right here. But you most likely are going to want to address it by kind of leaving the back alone, slowly working into a little bit of extension. So the stenosis back tends to be very flat without an arch. Okay, in the perfect world, we have a little bit of an arch into that back. Okay, like I have a really arched back, so it's hard for me to go truly flat. So we want to work a little bit into that arch, okay? But instead of directly working on the back, we kind of want to work on making sure upstream and downstream are working properly. So we're going to look at addressing hip mobility. Are our hips one of the issues causing our back to be less stable? What can we do to increase mobility of the hips? The other thing we're going to want to look at is our upper back, you know, being able to try to create typically extension in that upper back. So if our upper back is kind of like stuck over like this, okay, and it's meant to also be able to extend, you know, what do we need to do to address extension? Now, creating the sensation. So if you were to do work and it aggravates the back too much, of course, you know, stop. The issue is that you're not necessarily making things worse. You're just feeling sensations because you do have limitations in there. But at the same time, we do want to eventually get more extension in that back, but you just have to go really, really slowly because the stenosis backs get pissed off pretty easily. So different, in the little routine that I sent you, I do have links to the different Egoscue exercises that I'm going to show you today. Nothing should hurt. Stop if it does, okay? Different positions will feel better or less. So if you have stenosis, you might find, a lot of times people find sitting to be good, standing too long not to be good, lying down to be good, but not too long. I mean, you have very specific things and you'll start to know your body. So listen to your own body, okay? But the first that I'm going to go over is my very favorite exercise that's good for just about everyone, and it's great for everyone at the end of the day because we spend so much time sitting, leaning over, or standing, leaning over, or driving, leaning over. Okay, so this is going to reverse some of the negatives that we have being too flexed all day long, and it's going to help us create a stable thoracic area. So too many of us don't have enough stability in this area in our body. And this is core. I'm talking core, even though we think of core as just our abdominals. It's really about how this whole area is stabilizing and how well our arms and our legs are working in relation to this area right here. So, all right. So my favorite exercises are static back and diaphragmatic breathing. So with static back, I'm going to use a chair, but you might want to use an ottoman. You probably do want to get on the ground because we're going to allow the gravity to align our back. So I'm going to get down on the ground. I'm going to put my legs up on a chair. My feet are sort of pointed forward, but I'm not having to work at it because the chair is doing it. I'm relatively at right degrees, but not entirely. And I'm just going to relax like this. This is like sitting up without having to do any of the work. And it really helps to allow gravity to, when I've been slumped forward all day, to relax back. Also, if one pelvis is rotated or one shoulder is rotated, it kind of allows gravity to align my body. Now, if I did this on a bed, which was a little bit too soft, it's not going to do the same thing. You definitely can be on a mat, but you do want to be on something firm enough that would allow you to allow the weight of your body to realign yourselves. So once you're in this position and you're aligned, one other thing, if your thoracic area is so rotated that you find that your chin is pointing to the ceiling versus your head right here, you would want to put a small pillow under your head just to work on that. So when you're in this position, you can then work on diaphragmatic breathing, which is just sort of breathing and allowing your stomach to move up and out, your sides to go out. You're not going to be breathing into the back, but by working on this right here, you are going to allow a stability by tapping into your diaphragmatic breathing. So this one could be good for everyone. This one's great for everyone at the end of the day. This is my go-to when someone calls me and says, my back is in spasm, it hurts like heck, what do I do? You know, I typically don't see someone right away when they feel like that because they need to calm their back down a little bit. So I will typically say, try this, see if it makes you feel better. It helps almost everyone feel better. It helps almost everyone feel better at the end of the day when you've been sitting, leaning over a little bit too much. This is a great start, okay? Other exercises that are specific for the stenosis. So I chose exercises that are going to look at getting the hip more mobile, getting the upper back to extend without adding too much extension into the low back, and then creating pelvic stability, because most of us have issues because the muscles right here in our pelvic area aren't working entirely properly. And by that, I actually mean our glutes, you know, all leg muscles on either side and into our abdominals. They're not sort of stabilized equally, and therefore we're using our upper body unequally as well. So in previous classes, I've talked about hip mobility versus different things. Obviously, if your hips are super mobile and you had low back pain, you wouldn't necessarily need to do these first two exercises. But let me go over them. We're going to go over supine femur rotation and assisted hip lift. So, because I'm looking to not have my back over move, I'm going to lie down. I'm going to bend one knee so it's out of the way. I'm going to have this leg. This is the leg that I'm moving. I'm going to make it active. So in other words, it's relaxed. It's not doing anything. I'm going to kind of point my toes out. This is going to be active. And then I'm going to point my toes, but the movement's going to be coming straight from the hip, okay? I'm not moving my ankle back and forth like this. I'm moving from the hip. It's not going to be a huge movement, but I'm going to move out and in, okay? So a lot of times when your hips are tight and your femurs are stuck, this is almost like tightening it to get it to pop out, okay? This is typically okay if you have a degenerated hip as well. So the movement you see, it's not a big movement. Let me show you from this position. It's not a big movement. And it is going to move in and out. This is what it looks like on the other leg. So and you'll find that like this one, I'm moving in more easily and out a little less easily. So once I've sort of opened up that hip a little bit, now I want to stretch my hip itself, okay? So now there's different ways you could do it right here and open it up. So I'm just putting my foot over. I could have it here, I could have it here, and I'm going to actively contract to try to get into more of that number 4, okay? This might create a little bit of an arch in the back, depending on if your hip is tight in your anterior or your posterior hip, okay? A lot of people find success coming up to a wall, okay? Having your knees sort of at right angles, okay? If you're so tight that your butt isn't reaching the ground when you have a right angle here, move back so that both buttocks are touching the ground, okay? Then we're gonna put one knee ankle over that, and then I'm gonna actively look to open up this hip. So we're gonna hold this for about a minute at looking to make that number 4 stretch here. So we've unlocked our hips with the femur rotations, and then we're doing a type of a number 4 stretch or a hip stretch, an assisted hip stretch, to kind of remind that hip to move up. So now we've moved downstream and we've looked to loosen up those hips that might be too tight, creating that too much friction in what should be our stable back, okay? So now I'm gonna move upstream and do sitting floor, okay? So sitting floor is a lot harder than it looks. I'm gonna come up against a wall. I'm not having any movement into my back, okay? I am going to create active legs. So in other words, they're flapping here. I'm going to bring my toes up and I'm going to contract my quads, okay? This is already putting a fair amount of stretch on my legs, okay? If this is aggravating, then we'll find a different exercise for you. But then I'm going to sit up. So this is not really doing anything to my back. It is stretching my back line, and it is getting my upper back to have to work, okay, to be upright. But this is going to help correct some of your upper back without affecting your lower back at the same time. And typically you hold this for a minute or 2 as well. Once we have worked on downstream with the hip, upstream with the upper back, and there's lots of different upper back ones. Then we want to stabilize the pelvis. So in stabilizing the pelvis, we're going to work on, while sitting, actually, let me show you on the side. So while sitting, okay, we're going to sit like in the middle of our chair, and then we might be slumped like this, but we're wanting to sit up, not hyperextending, but we're definitely wanting to sit up. We're going to want to feel that we're sitting on both sit bones as opposed to one or the other. We're going to put a pillow between our knees. Our feet are about knee width apart. Our toes are pointing forward, and we're going to do knee squeezes. So we're going to take our pillow, we're going to squeeze, release, squeeze, release, squeeze, release. Now, if we have our pelvis muscles unequal, you might find that you're stronger on one and you would move like this. We want to work so that we tire sort of out our pelvic muscles, but that we're matching them. So what that looks like, let me move it back so you can see my feet as well. We're going to sit here. You can see that my feet are pointing forward. I'm sitting in the middle of my chair. I'm sitting upright. I'm going to squeeze, release, squeeze, release, squeeze, release, squeeze, release. So once I've worked the adductors, okay, that's creating stability on the inside muscles, then I'm going to take a band and I like the firm ones versus a stretchy one because I'm looking to create an end point with this. There's whole other exercises I like the elastic feeling, but in this one I want to create an end feel and I'm going to open up. So I'm opening up against a resistance of the band. So 1, 2, release, 1, 2, release, 1, 2, release. Lots of other different pelvic stability things, but most people tend to be off on either their adductors or their abductors. So this does tend to create, while stacked pretty properly, a pretty stable pelvis. And that's the routine that we have today for stenosis. Any questions on that before we go into spondylothesis?
Rachel, the upper back one. So you're sitting on the floor with your legs in front of you, feet flexed. Are you pressing your upper back to the wall so that the shoulders touch the wall?
You're aiming to, okay? But the reality is ironically, you're working more on your lower leg, okay? If you're really, you're contracting the quads, you're pulling up those toes, okay? And you are going to have to be more upright. Today I'm having no problems doing it. A lot of people find that to be a really challenging exercise. There are lots of other ways of correcting that upper back as well. Static back is one of them, but static back is totally passive, whereas the sitting wall has some activity into it. If you wanted to address it simply, like if you imagine that my legs were on the chair, or you could just come up against the wall. I suppose it doesn't matter, right? Because I'm pretty passive right here. Everything is pretty passive, but I could maybe squeeze, like have my elbows here and press into the ground. And this is going to be one way where my back is pretty relaxed, but I'm creating activity between my shoulder blades. So I've got gravity working against it, and then I'm activating the muscles back there. That will also help reduce that rotation. So that would be another exercise that would be really good.
Thank you.
Any other questions before I move on? Okay, so spondylothesis, the misalignment often creates a lot of discomfort. It's often caused, so it's trauma, arthritis, a fracture. There's all different names for exactly, if it's anterior, if it's posterior, if it was due to a fracture, if it was due to, it's also somewhat genetic on people. I think that some people just have a predisposition in their spine for that, but it often causes a nerve impingement pain, such as sciatica, numbness, tingling, or pain, sometimes even something as significant as like a drop foot, but that would be a really significant one, okay? So I often start with static back, which is that one that we had on the chair, okay? So we have, I'm going to pretend that I was up on the chair, okay? So, or you could be on the wall, but we're going to allow, and they have rounded shoulders as well. But with the static back, right? So if you have a spondylothesis, you probably, okay, spend too much time, whereas the stenosis has that flat back, okay? If you have a stenosis, you're probably going to hyper extend your back, okay? Because ironically, you're moving into it and it's already sliding forward. So we have this big arch, and then typically you're going to have a big arch here, and then you're going to have a big arch here. So you are going to be rounded here, but we want this back to relax a little bit. We want that vertebrae to slide back and to be in a little bit better of alignment. So We're going to get into the static back position. And imagine I was up on a chair, but certainly if you didn't have one, you could go up on a wall like this. This is very passive for me. And I'm, again, if my chin is tilted forward, I'm going to put a little bit of a pillow so that my head remains level. And I'm going to look to feel for my back to relax, okay? Because those muscles are going to be tight, they're going to be rounding, and over time, my back should relax. But I would certainly want to stay in this position. It's going to feel really good, but you're going to want to stay in this position till you feel your back relaxing into the ground. That was the purpose of this exercise, not just for alignment. It's also going to work on that rounded upper shoulder, okay? Now, the next exercise, oh, here it is. We're going to do an abdominal exercise. So now we're going to be in this position against the wall, okay? I'm actually going to get in closer. So now I'm going to get in closer so my butt is like 5 to 7 inches from the wall. So you can see my shins are parallel, okay? But my butt is not under my knee, okay? My butt is forward of my knee. I'm closer to the wall. My knees are right here. So now I'm going to put a pillow between my knees. I'm going to squeeze with about 65% of my power for about 4 minutes, okay? And I'm looking to allow not to have the movement come from my stomach, but just from my legs, okay? So now I'm going to relax here. This is going to help release the hip flexors, and it's going to help release the upper back as well. So we're just going to lie here and in this position, keep the resistance against the pillow and just allow that to work for a couple of minutes. Then we're going to try child's pose, okay? So child's pose can be done several different ways. Nothing is meant to cause discomfort. Depending on other arthritises you have in your body, I'm going to show you a couple different ways that we could do it. But the thing with child's pose is, amongst other things, like we have a flex back. You can see my back is rounded. It's not extended, okay? So we have that spondylothesis typically has problems with extension in the back. We want to kind of lengthen out the shoulders. We want to feel a nice stretch. So child's pose can be really good. How can child's pose not be really good? This might be too much on my shoulders, okay? Because my shoulders are sort of over by my ears. It might also be too much on my hips because my butt is mostly down by my feet, not quite, okay? But if this would be good for you and it's too much, we could lessen the hip by putting like a pillow behind us. Okay, so now I have space. It's hard to see because they're different colors. And I might just come like this, okay? So now I don't have as much of the shoulder and I have a pillow in there and I'm still stretching into my low back. Okay, so that's the routine that I have for the spondylothesis. Any questions on those before I talk a little bit about my favorite alternate therapy for these two?
It's Leslie. I have a quick question. When you're doing static back, what's the safe way to get up? Because if you're lying there and your back is relaxed,
Yeah, okay. So being able to get up is life-saving, okay? But we do want to get up safely. And the last class that I taught, where I showed multiple different ways of getting up from the ground, I think, could be helpful. But let me show you a couple different ways, okay? So now here's another thing. If someone really couldn't safely get up from the ground, but they want to work on some of these things, particularly like if your back is super painful or you hurt your arm or something like that, you could have a firm Like a coffee table might be a little bit of a small space, right? Like too small, but you could take a firmer like piece of wood and put it on your bed. Okay, so therefore you're on a hard surface, but you're not on the ground. Okay, and then obviously you wouldn't put a chair, but you might. I have these in my office. I had them. I don't have them here, but they're more like a big square pillow. It's very light. You know, that would be on my bed very easily. So certain people, I might have set them up on a harder surface, but it wasn't on the ground. Okay, but say you were on the ground, and it's important for us to be able to get up from the ground. All right, so one of the ways that I'm going to get down to the ground, all right, now granted, in theory, if you can get down without having to touch and hold and use knee things, that's great. But if you need to, of course, have it, okay? So I have it, multiple ways that I could get down, okay? But I'm going to use like different, like getting up and down on my knees. I'm going to have something that I can hold on to. Ideally, we want to have leg strength enough, more than just depending on our arms, okay? But, you know, we're going to get down, and we're going to get down on the ground. And then I'm going to scoot close, and then I'm going to come up here, okay? So now I'm here, I'm relaxed. I'm going to get back up. I'm going to take my legs right here, okay? I'm going to scoot around. I can roll on my side, okay? I can press myself up. I'm going to have my hand here, or I can have my hand here, and then I'm going to come up right here, okay?
Thank you.
Does that answer your question?
Yes.
Okay, excellent. Always important to be safe in any of the activities that we're doing. At the same time, the ability to remain independent at home is the ability to get up if you've fallen. I don't mean that you broke your hip, you know, but in general, that we can balance and that we can get up from the ground. Really, really important things. It is a skill you don't want to lose. So I recommend practicing it every day if you can, okay? Because it's very easy. I think when I taught my last class that I had done different elements, my mother had for years had too much power where she used her arms to be able to get her up, and her legs had gotten really weak, and then she'd gotten sick with COVID this winter and things kind of like declined a little bit. Then she slipped and fell on the ice. It was a bad winter for her. She slipped and fell on the ice and injured her shoulder, but she'd been depending for years on getting up from the ground by really using her upper body because her lower body wasn't very strong. Well, our upper body isn't nearly as strong as our legs are. And then when she slipped and fell on the ice and she injured her shoulder, she could not get up from the ground anymore. So this is just not skills that we want to lose. And the strength in our legs is incredibly important at being able to get up. Now, if we injured our leg and we had to use our arms, great. But we want to be strong enough in our legs to be able to get up ideally, which is why in our last class, we broke down the elements of the strength of a squat, you know, the different parts of a squat, so that we could build up the different strengths. Okay, so one of the things that actually has helped people the most is rock tape, which is a type of a kinesio tape, which I placed over, and I did have a link of how it was applied. I don't feel like they apply it as well as me, even though they are the instructors, but it's in that same sort of an H. Very distinctly, they just went across. So it's up and down and then across. I'm very specific at where I do across. I look at the back and I'm like, I can just tell where their most unstable vertebrae is. You know, you can kind of see it. It typically sticks out a little bit. And I will put the supporting piece across right where I find the most important part was. You cannot put this tape on yourself. Not in that area or not very well, but you can easily, if it's helpful for you, have someone else do it. So a lot of people get relief from the massages that I do when they have stenosis or spondylothesis. if they're not doing their exercises at home, it doesn't necessarily last. It's not going to get rid of the fact that you have this stenosis or you have this spondylothesis. But what I feel like it really helps is everyone comes in with some rotations. And even though exercises are one of the best things for the rotations, when I'm doing a massage, I am looking to balance everything out. If one pelvis is rotated or the muscles are unequal in the back, I am looking, every stroke I do is looking to sort of correct people and neutralize people. And then I put this tape on top of it, and it makes the benefits of the massage last a little bit longer. The tape works very specifically. It's a plastic medical grade tape. I use rock tape, but you could use any of the different brands. It's stretchy, okay? But what it really does is it changes how your brain feels about the area. So there's more than one reason why this could help you. For one, depending on how you apply the tape, it's literally going to upregulate or downregulate or hold posture for your nerves. So it's going to upregulate or downregulate. I only work with people typically in pain. I don't upregulate at all. Someone with cystic fibrosis or some sensory issues might want to upregulate, but I'm looking to decrease pain. I'm looking to downregulate nerves. Okay. So depending on how you apply it, typically the body's on a stretch, and then you're going to apply the tape not on the stretch. And when someone goes to stand up, it wrinkles a little bit. So you're going to reduce the tone in that area. So someone's got a tight back. I've put the tape on. It's going to, I've already massaged them. I've evened out their pelvis. And then I'm going to reduce the tone in that area. And then the piece across, you stretch it just a little bit, but not on the ends. Okay, otherwise it's stimulating too much. I stretch it just a little bit, like 10%. I've gone right over that, what I think is the least stable vertebrae, and then the edges are not pulled tight, or else it irritates the skin because it's too stimulating. And I find that's very, very helpful. I think it's more helpful after a massage than if you just did it on its own. However, I have a story of one of my favorite 84-year-old clients who I haven't seen since COVID, but he had back pain, loved his massages, but he had a lot of stenosis. He was 84. He had gotten less and less active. The massage was great feeling, but it didn't really get rid of his pain long-term. So then I said to him, he was not athletic, but I said, hey, let's put this athletic tape on your back. And he was like, well, what do you think that's going to do? I said, who knows, but let's give it a try. So we put it on, and all of his back pain went away, all of it. Okay. As long as he had the tape on. So he loved this stuff, he not only wore it all the time, he had his wife learn how to buy, to use it, and he brought it on vacation. Well, then it started only working about 95%. And then it started working not at all, he says, but I have a feeling it was working. He was just starting to feel it a little bit more. Well, what was happening? He was getting out of pain. To a certain extent, it was tricking his brain. He wasn't getting rid of the stenosis. It was helping the tone of the tissue underneath. He wasn't getting rid of the stenosis, but he wasn't taking that time when he was not in pain to really set up his body properly. Okay. So when his brain was confused by the tape, because the tape really works with our nervous system to let us feel things differently. So a lot of people also have pain because your area is, I'm going to use the word smudged. So our brain has parts of our brain that really is like the visual of what's happening in our body. Okay. And if you've had pain in an area, or you've had surgery, or you've had injuries, sometimes that area gets smudged, and our brain doesn't have a really clear picture of what's going on in that area, and it doesn't know what signals to have. So it will fill in that area to protect you with pain. This is an unnecessary pain. Pain has a purpose in protecting ourselves, But in the case where it's just smudged, it's not a necessary pain. It's not going to help us in any way. So tape will really help give the more proper signals where it's saying to the brain, this is what's going on in that area. That's what's helpful. So the tape is kind of amazing, but I like everyone to understand, you know, he went from the tape was absolutely miraculous to the tape is no good whatsoever. Well, no, the tape is actually as good as it's applied and used, but he missed a window of time to really set his back up properly, which was partially my own fault for not really pushing him to do that. But it can be pretty miraculous. Most people get a lot of relief. There's other tools too, if you happen to be one of those people with a smudged area. So tape is one way that our brain feels an area, it connects our brain to that area. But there's other tools like bumpy balls. When people do Graston technique, very lightly, not heavily, that's going to, you know, give sensation. Cupping, I do a lot of cupping on people. That's going to create sensation and really give the brain a better picture of, you know what, this is what's going on through the body. When people come in for a massage, and a lot of times they're like, wow, I didn't realize I was so tight there. I didn't realize that, you know, I was so sore there, or this or that, or this was better than I was expecting. To a certain extent, as we've learned more about why massage is helpful, one of the reasons why it probably is helpful is you really get a mostly through the whole body re-picture to our brain of what's going on. So this is one of the reasons why massage can be very helpful, but you don't necessarily have to use massage. You could use any of those tools to tap into the other body parts to give better signals to the homunculus in the brain for why it can be effective. So anyone have any questions? I just want to say hi, Kristen. I'm glad to see you today.
Hi, it's nice to see you too.
Anyone have any questions on today's class?
Right, Rachel, hi. Excuse me, it's Susan. Excuse me. Will you at some point maybe do a class on stenosis of the neck, which is a completely different animal?
Yes, I will research it because honestly, so when it comes to stenosis of the neck, in the research that I was doing for this class, like it brought up for the first time, really what you want to do is work on alignment of the neck. So with any of those things, you want to work on alignment, right? There are a couple of classes in the past that I've done on necks, right? So if you look back on them, but I will try to, I mean, I absolutely don't feel like I'm an expert at it, but any of the ones where you are going to work on alignment of the neck is going to be helpful. So here's what is different of the neck, which is also supposed to be stable, right? So low back is supposed to be stable. The neck up to the occiput is supposed to be stable, and the occiput is supposed to be mobile. So what's different with the low back than the neck is that our body, if this is flat, okay, this is going to be forward. But also, you know, depending on the level of curves, to keep from falling over, the neck is further up the chain of compensations to make up for stuff down below. So a lot of people will be like, they'll be like this, okay, and they're stuck forward, and they're like, oh my gosh, look at how stuck forward my neck is. I've got to get this way back here, you know, to kind of get my head aligned. But if they haven't corrected the pelvis down below, if you had corrected the pelvis, you will find that people are trying to correct themselves by almost getting into this position, right? So I would look at some of the classes for aligning of the neck, but I would take into consideration what's going down at the pelvis. But I'll try to do some stuff, but you can also email me because I definitely want to research it myself too. So.
Right, great. Thank you. Thank you very much.
Anyone else have any questions? You guys can always email me. I'm going to be doing, hopefully, a lot more different classes, including I'm working into a new website, and I'm going to be having a free members area with all sorts of different stuff, holistic health. I have a wealth of information. I'm one of those sort of geeky people who always are looking for the answers of things, and I love sharing it. And I do feel like my purpose in life is to share this information, mostly information that we've so commonly accepted dysfunctions as normal as opposed to common dysfunctions. And I really feel like people can have such better lives and more quality of life if we get this information. So, and I'm like a fix 80% and then you tweak the last 20%, you know, but almost everyone fits in the 80%. And then specific to you is that last 20%. So I love sharing this information. So anyway, any other questions?
Let me ask one more. You know, as a rule, is walking meant to be good for the lower back pain, or is it all just a personal, whatever your body feels good at?
Everything is supposed to be good on your low back.
Okay.
Walking is going to be my next class. Amy asked me to do a walking class, and gait is a little tricky because gait's like moving on top of hopefully an aligned body, right? And I had actually just signed up for a great class that I'd like to take myself. It's on gait and walking. So I'm hoping to like actually do the class and then bring in parts of it. And I just haven't set up the dates yet. It will be in May because I just haven't done that yet. So that will be our next class. But in theory, right, there are 3 foot to gait classes that I've already done. They've been pretty popular. They're a great start. But again, because everyone is starting to get out and walk more, I'm going to try to do, and it might be 2, I have to look into it. It probably is going to be 2 different classes building on top of each other that will be specifically to walking. But they will tie into other stuff that we had. And it's almost great to have a review of the feet because feet are like our basement when we're walking, and then we have our pelvis, and then our upper back is over that. So we ideally want to have a more functional foot, a more functional pelvis, a more functional upper back. And then walking is where we're adding movement into it. So anyone that wants to review any of those classes, it can always be helpful. I will probably have review in this, but some of this stuff takes time. So you might want to start by looking at some of the foot classes that I've done in the past, and I will hopefully get dates to you, Amy, soon.
And speaking about reviewing, I can always use review about how to check my chain.
Okay.
Or my ears, shoulders, hips, whatever. So every time you mention that and give me a little cue as to how to check that my chain is okay, I appreciate.
Okay, well, some of the easiest things is to catch yourself in a mirror, you know? Mm-hmm. Like, may I point out one thing to you that I've just observed?
Sure.
Okay, you have a tendency to tilt your head. Okay, you're tilting to the other side though. Like it's to your right, I think, but I have a feeling that you're tilting that way in the thing. And that's coming from something that is probably affecting a couple things along the way. I mean, in theory, that's going into our head level, but you know, posture and how we move, it's like the injuries that we have. It's our whole life story. It's that we held babies on one side, we carried groceries on this one, or we injured that hip. It's not necessarily bad. What gets in the problem is it repetitive? Is it causing pain? Is it really a dysfunction, or is it simply my body's way of moving because of all this wonderful, rich history that is you? But if you're suddenly getting neck pain, or you're getting something and you notice that your head is going that, what do I have to do at the end of the day to introduce equal movement, or to equalize that you also are a neck nodder, which is, I think in one of the neck classes, when someone comes into me with neck pain, right, the first thing I look at is I say, okay, check your phone. What's going on with your phone? And people typically go down like this. So I'm like, okay, so we need to teach you how to work better with your neck with devices. The next thing I do is I look how they move. I'm like, look over your shoulder. And most people will go like this, and I'm just looking at how well they kind of move their body as a unit. I'm tricking them a little bit, but I want to see where their brain goes first. And then I notice how often, now this is only a problem really if you have neck pain, right? But people will tend to relate to someone. So you're listening. I want you to know that you're really connecting with me. And they nod and nod and nod and nod and nod. And that's a wonderful way to get rapport with someone. But you use your neck a lot. So if someone's going to have neck pain and they're one of those people that are always nodding, and people wearing masks, I've noticed that they're nodding more because it's harder to get that rapport with just your eyes, So when someone comes in with a lot of neck pain, almost everyone that does have neck pain is a neck nodder, and they nod a lot, and they never noticed it till I pointed it out. Now, it's not a bad thing. Rapport with someone is incredibly important, but if you have neck pain because of this, how else can you get rapport with someone without overusing that neck muscles?